Hello, my name is Minette Richardson. I'm a registered dietitian, a certified diabetes care and education specialist with Diabetes Education and Research Center. The objective is to provide a basic overview of diabetes and prediabetes and what are some of our concerns. So let's first look at the diabetes facts of 2020. If you look at this illustration, we're first looking at the iceberg. 34.2 million Americans have diabetes, and the CDC projects that as many as 1 in 3 adults in the U.S. could have diabetes by 2050. When you look below the tip of the iceberg, then you see an estimated 88 million Americans have prediabetes. 9 out of 10 people with prediabetes do not know that they even have prediabetes. And we know that without intervention, 15 to 30% of the people with prediabetes will develop type 2 diabetes within 5 years. So type 2, this is an epidemic because in the last 20 years, the number of adults diagnosed with diabetes has more than tripled as the U.S. population has aged and become more overweight. Additionally, we are looking at type 2 diabetes in children. It's not just for adults anymore. The number of children and teens with the condition has skyrocketed over the last 20 years as well, and it is still climbing, prompting experts to call it an epidemic as well. So let's talk about what is diabetes. Well, the simple version is that diabetes is too much sugar in the blood, and people with diabetes produce too little insulin and are resistant to the effects of insulin. It's a lifelong or chronic condition. So we talk about insulin, so what exactly is insulin? So when you first eat your food and it starts to break down into the nutrients, it breaks down, especially when you eat carbohydrates like grains and cereals and breads, as well as fruits and milk and yogurt, breaks down into glucose or to sugar, which is in our blood. It also tells the pancreas to release this hormone called insulin. And insulin is what is needed for the glucose to get into the cells for energy. In other words, it's the gasoline in the tank, and you need to be able to get that gasoline into your cells where you use it for moving and breathing. It also feeds your brain, so you need to have glucose for your brain. You also store glucose in your liver where you use it in the fasting phase or under stress. And extra of the glucose, or the sugar, is stored in the stomach area as belly fat. So before anybody has diabetes, we look at the numbers for prediabetes because prevention is no different from treatment in either one. And when we remember those numbers that we saw initially, we really want to be able to look at where people stand with prediabetes and diabetes. So let's look at a normal fasting blood sugar. So in the green, we have the fasting blood glucose. And if you go to have your lab work done and it's less than 100 milligrams per deciliter, then you're in the normal range. If your numbers are between 100 and 125, that's generally a red flag that your blood sugars are in the prediabetes number range. And if your blood sugars are over 126, they'll probably test you twice because it's usually a red flag that you may already have diabetes. The other thing that they often look at then is your A1C, which is the average of your 3-month blood sugars. So in the green, it should be below 5.6%, which is normal. In prediabetes, your A1C would be 5.7 to 6.4, and in the diabetes range, it's over 6.5%. And I mentioned that A1C again, it is the average of what your blood sugar numbers look like over a 3-month period. And what this slide illustrates is that if you're in the green zone, then you're in control or not in a diabetes range. In the gold or yellow zone, your blood sugars have been elevated for over 3 months. And then if it's in the red zone, that means they're seriously elevated levels. So we talk about prediabetes because, again, that number is really, really high, and it's the numbers, but prediabetes is when your blood sugar is in that range where it's a little too high. Sometimes you'll hear the doctor say, oh, you have a touch of sugar, but it means that your long-term damage may have already started. And where does it start? Usually with unhealthy eating habits and lack of exercise. 1 in 3 American adults have prediabetes. So there are other types of diabetes as well. Type 1, which is the less common one. Only about 5% of the population have type 1 diabetes. Used to be called the juvenile diabetes, but now we see that some young adults also have type 1. This is the type of diabetes where your pancreas is not making any insulin at all. Generally, this is an autoimmune disease, which means something has destroyed the pancreas's ability to produce insulin. The individuals who have type 1 diabetes are on lifetime of insulin injections. Whereas type 2 diabetes is more of the lifestyle type of diabetes. It's about 90 to 95% of the total population of people who have diabetes. So the pancreas is making some insulin. Cells can be resistant to the insulin, which means that basically you're not able to utilize your insulin properly. And in some situations, the liver makes too much sugar. So we talked about the liver as where you store sugar for when you need it in the fasting phase under stress, and you're making too much of it. And when that happens, it doesn't tell your pancreas to make insulin, and individuals may see high blood sugars from that. And people with type 2 diabetes may ultimately require insulin. There's also another category called LADA. It's an autoimmune disease similar to the type 1 diabetes, generally seen in the adult onset, usually not insulin resistant, so they're usually not overweight. They're usually doing everything they are supposed to control their blood sugars by watching what they're eating, doing their physical activity, monitoring their blood sugars, but their blood sugars are significantly elevated. And eventually they may require insulin because the pancreas, again, may not be producing insulin anymore, similar to the type 1. While it's not that common, we are seeing more of the LADA because we're seeing possibly more environmental problems happening with this population. Then there's gestational diabetes. It develops generally 24 to 28 weeks of gestation during a woman's pregnancy. We're looking at approximately 7% of the population. But the reason why it's of concern is that once the mommy has her last children, the individuals who've had gestational diabetes are at much greater risk for type 2 diabetes, about 11 years after their last baby. So they are at greater risk, especially if they don't maintain healthy lifestyle changes for what they eat and their physical activity. And the other issue with women who have gestational diabetes is if they're not in good control, the babies themselves are at greater risk for having diabetes later on in life. So let's look at some of the general risk factors for developing diabetes. You see on the right-hand side, family history, genetics, and age. So let's just talk a little bit about that. Family history of diabetes. So if your mother or father had diabetes, or a grandparent or aunt and uncle, it could very well be then you have the genetics or predisposed to have diabetes yourself. Women who have gestational diabetes, as we mentioned earlier, are at greater risk for developing diabetes. And also a baby who was weighing 9 pounds or more at birth may have had a mother who was not in good control while she was pregnant, and they're at greater risk of developing diabetes. Overweight or obese is a risk factor for developing diabetes. And again, we're seeing that not only in adults, but as well as these children that are obese. Age 45 or older. As we grow older, often certain parts of our bodies are not functioning the same way. And one of the issues that may be arising is the individual's pancreas is not producing enough insulin. Some women who have polycystic ovary syndrome, or what we call PCOS, is a form of insulin resistance, and they're at much greater risk for developing diabetes. And also, individuals who have dark, thick, and velvety patches of skin around their neck or armpits, that generally is a potential symptom for insulin resistance and a risk factor for developing diabetes. We also know that certain ethnic groups are at greater risk. So the Black or African American population, the Hispanic or Latino, the Asian Americans, Pacific Islanders, American Indians, or Alaska Natives. So a little view, bird's eye view too about type 2 diabetes for risk factors is individuals who have high blood pressure, high cholesterol. With that, they also have a sedentary lifestyle. They are overweight or obese if they're eating a high-fat diet, eating too many calories. And smokers tend to be at greater risk for developing type 2 diabetes. So there are a lot of different things to look at relative to developing or being at risk. So let's just take a look at what some of the symptoms are of diabetes. So probably one of the most common starting risk factors or symptoms is always being tired. So if you need to get the glucose or the sugar into your cells and you're not getting your fuel, the result is that you could be very fatigued or tired. Another symptom is the frequent urination and always being thirsty. So when your blood sugars are high, what often happens is that the fluid or the water in your cells is trying to dilute the sugar in your blood, and it causes you to go to the bathroom more. Then you feel like you're thirsty, you drink more, you have to go to the bathroom more. So I would say that tends to be the most common symptoms individuals complain. They're up all night going to the bathroom, which is very, very common symptom. We also look at always being hungry, eating all the food, but you're not getting that fuel into your cells. So you're hungry, and then we often see a significant weight loss. It could be anywhere from 15 to 25 pounds in 1 month. Another symptom is sexual problems. So often men are not aware that they have erectile dysfunction because their blood sugars are high. Because when the blood sugars are high, it can affect the nerves. It can affect what you need for sexual function. And women who have elevated blood sugars may often experience vaginal infections, and that's because when the blood sugars are high, it's a perfect medium or perfect place for bacteria to grow. Probably another very common symptom that may occur is sores or cuts that don't heal. So an individual may just get a sore on his foot or a cut and it just won't heal. Well, the furthest from your heart are your feet, so that's where it's probably the most common, and the nerves are affected and your body's ability to fight any type of infection. So that is one of the symptoms that we have seen. In addition, the tingling in the feet and in the hands. So when you are experiencing elevated blood sugars, it affects the circulation, it affects the nerve endings, and generally it starts at the feet, which is the furthest away from your heart, and then it goes up the body. And one other is the blurry vision, because again, the blood vessels around your eyes can be affected by elevated blood sugars. So there are lots of symptoms that might give you an idea that something's not right. You need to go see your physician. And why? Because if you look at this slide, symptoms and complications are hit you from head to toe. So let's go in and talk about patients. So individuals who have diabetes generally die from the complications of diabetes, with heart disease and stroke being the #1 complication. About 60% of the individuals who have diabetes have heart disease or stroke, and that's the cause of mortality. Along with that, high blood pressure. So many of the individuals who are being treated for diabetes are also being treated for high blood pressure. They may also be being treated for elevated cholesterol levels. Blindness. We already mentioned that it can affect your vision, but if it progresses, it can definitely affect the blood vessels in your eyes. It is the leading cause of blindness in the United States, is uncontrolled diabetes. Another one is kidney disease. If your blood pressure is elevated as well as your blood sugars, it can have an impact on your kidney function. And over time, it can affect it to the point where the kidneys do not function on their own and individuals end up on dialysis. It is one of the leading causes of individuals being on dialysis. The nervous system damage. As I mentioned earlier, when your blood sugars are high, it can affect how well your nerves are performing, your blood vessels, and generally starts at the very bottom of your feet, and that's usually where you see the beginning stages of nerve damage. And eventually what can happen is individuals don't feel their feet, they lose circulation, they might get a sore, they might get gangrene, and lose one toe, another toe, and eventually end up with an amputation. So it is one of the leading causes of amputations in the United States is from uncontrolled diabetes. Dental disease. Well, dental disease, it's a twofold issue. If you have dental disease, it can cause your blood sugars to become elevated or high. But at the same token, if you have elevated blood sugars, it can cause dental disease. So we want to make sure people have their teeth checked and their gums, because that kind of bacteria can be very detrimental to individuals' heart health. And one other thing that really has been more recognized recently is depression. So if your blood sugars are high, individuals may feel depression because they're just basically not feeling good, or they're on edge, or the depression can be because they're experiencing problems with coping with chronic disease. So here you see all these complications. Diabetes is the 7th leading cause of death in the United States. So 1 out of 4 people over the age of 65 has diabetes. And now we're even more concerned with the COVID-19 because individuals with diabetes are much greater risk for having multiple complications and are at greater risk for COVID-19 mortality. So let's take a step back and measure your health and look at your risk factors, family history, your diet, how old you are, your weight, your lifestyle, inactivity. You also should know your number. So if you're not familiar, again, the normal number for your fasting glucose or blood sugar should be below 99. But if it's in between 100 or 125, then that's generally a red flag that you need to pay attention to because you're in the prediabetes range. And then diabetes is generally when it's 126 or above in your fasting blood sugars. So do know what your numbers mean. Just a real summary of how is diabetes managed, just a few pointers. Diet is the first thing that we look at because what you eat is very important, including a diet high in fiber, with healthy fats, watching your total intake of calories. Increasing your physical activity. If you're not doing any physical activity, it is recommended 150 minutes of physical activity a week. If you already are diagnosed, you want to continue to monitor your blood sugar numbers to make sure they're in range with what you and your doctor have agreed upon. If your physician has given you medication, make sure you understand what medications you're taking and when to take them. And we also mentioned stress as an issue relative to increasing your blood sugar. So you want to make sure that you monitor your stress so you're not releasing too much sugar into your system because you're under a lot of stress. So stress management is important. I hope this has been helpful, and thank you for listening. This presentation was made possible by the generous donation to the Diabetes Education and Research Center. It has supported underserved population in the greater Philadelphia area since 1967. We can do more to reduce health disparities, especially since 34.2 million people in the United States have diabetes and 88 million have prediabetes, but racial and ethnic groups are disproportionately affected by the disease. Make a donation, honor someone you love. Please support the Diabetes Education and Research Center by making a donation to honor someone you love or remember someone you've lost. Your tax-deductible donation makes a difference. So again, Diabetes Education and Research Center, if you have any questions, You can call us at 215-829-3426, or you can email us at info@diabeteseducationandresearchcenter.org. Thank you.